Hi everyone. Today I'm going to talk about a safety issue relevant to my practicum placement, along with my agency's safety policies and a discussion I had with my field instructor. I'm currently completing my practicum at a men's detox and rehab facility in Harlem, New York. Recently, I had training with my field instructor on motivational interviewing, or MI, and how it connects to safety planning, especially for clients with substance use disorders. Motivational interviewing is especially relevant in this setting because it was originally developed to help individuals with substance use disorders build motivation for change. Many of the clients we work with are ambivalent about recovery, and that ambivalence can directly impact their safety. One important safety issue in my setting is how to support clients who may be at risk for harm, whether due to relapse, withdrawal complications, or mental health concerns, such as suicidal thoughts. My field instructor emphasized that safety planning is most effective when it is collaborative, and this is where motivational interviewing becomes really useful. At first I wondered, what if using MI somehow reinforces harmful choices? But what I learned is that MI doesn't push clients in a specific direction. It helps them explore their own motivations and resolve ambivalence, which can actually increase their willingness to engage in safety behaviors. There are 4 key processes in motivational interviewing that can be applied to safety planning. The first process is engagement. This step is all about building trust and listening. The counselor forms a partnership with a client and creates a safe space for them to talk about what's going on in their lives. The second process is focusing. Here the conversation narrows to a specific concern, such as suicidal thoughts, relapse risk, or unsafe behaviors. The counselor listens carefully for what's called change talk, or statements that suggest the client may want things to improve. The next process is evoking. In this step, the counselor asks open-ended questions and invites the client to share their thoughts and feelings. We might explore why they would consider making a safer choice, or even why they might not want to. This helps the client process their ambivalence. The fourth process is the planning process. Finally, we work together to create a plan, but only with the client's agreement. This could include steps towards safety, like reducing access to harmful means or identifying support systems. One key takeaway from my field instructor is that MI supports safety planning, but it does not replace mandated reporting when there is an imminent risk. In addition to clinical approaches like MI, my site has several structural safety measures in place. For example, there is 24/7 medical supervision during detox. This is critical because withdrawal can be dangerous, even life-threatening in some cases. The program uses medication-assisted treatment, which helps manage withdrawal symptoms and reduces cravings safely. Clients stay in a controlled, structured residential environment, which minimizes exposure to triggers and allows for close monitoring. The facility also provides a safe and supportive living space, including meals, clean accommodations, and a calm environment to support recovery. Care is provided by a licensed multidisciplinary team, including doctors, nurses, and mental health professionals. Each client receives an individualized treatment plan based on a thorough assessment of medical and mental health needs. The agency also emphasizes integrated care, meaning they treat both substance use and co-occurring mental health disorders, reducing risks like relapse or psychiatric crises. During our discussion, my field instructor highlighted that safety is not only about policies and procedures, it's also about how we communicate with clients. We talked about how clients may resist safety recommendations, especially if they feel their autonomy is being taken away. That's why MI is so important. It respects the client's autonomy while still guiding them towards safer choices. This really changed how I think about safety. Instead of just telling clients what to do, we collaborate with them, which can actually lead to better outcomes. To end, I'd like to ask a question. How would you balance respecting a client's autonomy with your responsibility to ensure their safety, especially if they're resistant to making safer choices? Thanks for listening, everyone.